Hey, Jaspreet, welcome to the Experience Dialogue. It would
Yeah,
be a fun discussion. This is a forum where we are actually having discussions, people with friends, and no qualms about interrupting each other. So, respectful disagreements. And so, this is going to be a fascinating discussion. I'm so excited to have you on board. And I'm looking at your LinkedIn, Jaspreet. You have done pretty much everything post sales. You have done customer success, customer support, you have done sales, the service contracts, yada, yada, yada. Tell us a teeny bit about everything that you have covered so far.
no, thank you so much, Kay. I'm so excited to be here. Thank you for having me. Yes, I think, as you said, we've all been in this industry for the last 3 decades and more. And fortunately, I've been very fortunate to actually dabble my hands in all parts of customers' life cycle. So I consider myself lucky. But also, I think that I've been very intentional about my overall customer journey because, this is one thing that I actually talk to a lot of youngsters and early career professionals also. How do you think about your career? And I think when I was starting, obviously I started in customer support, but I was very clear that I don't want to be in customer support all my life. I want to be managing a P&L. I want to be general management at some point of time, not the title per se, but I
Yeah.
want to be doing general management. So that took me to a journey where I moved from customer support to consulting, then professional services, then sales, delivery, sales excellence, by the way, and then back to support. So I think it's been very intentional choices that I made during my career. And part of it was to really make sure on how I can participate across the customer life cycle. Because I think many times we tend to gravitate towards one area, make that
Yeah.
as our expertise area, and we say, oh, we are good with that and we're going to stick with that. And that's not a wrong thing to do. But I think for me, the choice was more breadth and depth in every single area, but then keep going breadth and so on. So I think in my case, I just chose that path. Not saying one is better than the other, but I think it has served me well because I personally believe that having touched customers across the whole life cycle, I can appreciate right what their issues are, what their requirements are, what the outcomes that they expect, what builds trust, what creates loyalty, rather than just saying I'm going to sell by relationship or sell by force, right? So I think it just has been intentional, but a very fortunate career journey for me also.
Yeah, for you it was intentional. For me it was accidental.
It's fine too, right?
So my first right out of college, I had a company where I there were three amazing people working, me, myself, and I. So I
Uh-huh.
didn't know how to scale the business, and that's when I moved into working for bigger companies where I did sales engineering, marketing, etc., and learned the various aspects of the business. So I always think what you just said, everything about doing from professional services to sales and all of that gives you a perspective to run a business completely. Another fascinating thing with your background is you have done, you started at Microsoft, then you were at Autodesk, and you have been in technology companies. Why Empower Pharmacy?
That's an interesting question because I keep getting that a lot nowadays. So I think it was an interesting choice to make, right? When I was, when we all reach this stage of the career, I don't want to mean that I'm old, but I'm, but at the stage of career
You
that I
look like
am,
you're 18. No, 21 will make a drinking age, but
just 21, you guessed it right.
yeah, exactly.
So I think when I was at a stage of my career where I was deciding what makes sense for me professionally in terms of my learning growth, which actually has to continue, whether from a breadth standpoint or from a depth standpoint. But also at this stage, I was also looking to find more meaning, more purpose for what I want to do, which actually can leave a larger legacy and impact, not just to myself, but to the larger community, to the world that I belong to. And I think when I got this opportunity or when I was thrown this opportunity over to me, I thought this medication is a huge area of challenge this country faces, right? We all need
Yeah.
to participate in these challenges and be able to solve those challenges because the larger humanity needs those. And that's the legacy that I want to leave. I want to make sure that whatever businesses I do, I'm able to not just leave the legacy of me and myself, as you were talking about, and growing it just vertically or from a monetary standpoint, but also leaving a lasting impact to the humanity that we all belong to and can contribute to worldwide problems that we have. Now, within the US, as we all know, healthcare has been a huge issue. And I've been very passionate about healthcare from the word go. As a matter of fact, some of my family members tell me you're a pseudo doctor also because I can prescribe medications and then talk about a lot of the
No,
symptoms
no,
and
no, no,
stuff.
no, 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 no,
I
no.
don't prescribe, but I can
Yeah,
try it on my own,
exactly.
right? So I think that the interest was always there on what we can do. So I think when I got this opportunity of Empower Pharmacy, I was blown away by the fact that this is the compounding pharmacy, which is making personalized medicines for the people who need the most. And some of these medications are life-changing, even though they are not traditional medications in a sense, but they're very personalized. Men's health, women's health, hormone replacement therapies, and so on. Newer areas, but it's really life-changing for patients who experience that. So I realized that this personalized medication or this particular industry benefit if I can go there and bring a lot of the learnings that I've been having in the technology space and can apply it to our patients, our providers, and our prescribers to help them with the journey. So I think my intent was two-way. One, how can I help the company, and how the company can help me in my own growth, and both of us can help the larger problem that the US is facing at this point of time, which is healthcare. So that's why I kind of just joined.
Yeah, it makes a lot of sense and it also resonates quite well, right? So we work with medical devices, one of the industries that we work with, and I can imagine during COVID time, people couldn't go into the hospitals.
True.
They had to utilize, AI agents to really diagnose, troubleshoot, triage problems without even going into the hospital. And that was a huge impact. So one of the times I actually had it in my LinkedIn said, save lives and create experiences with our field service agents. And then somebody said it's cheesy.
Yeah.
So at some point I removed it. But let's talk a little bit more about taking a technology approach into a company like this, right? So for example, in the technology industry, things are slowing down you can see the stock market has slowed down, but every healthcare company I talk to, they have 3,000, if they have 3,000 openings, they are only able to fill in 10% of the openings. They have so much dearth of specialists because, 60% of their workforce is retiring and they have a lot of problems. They are only finding generalists. So it's a very different between what you see in tech and what you see in healthcare.
Yeah.
How does automation help with the problems that you see within the healthcare industry?
Yeah, no, I think that's actually a very, very good question. And that probably will determine what the future landscape of jobs will look like. I think just because the supply or the demand was very high in the IT software industry, the supply tend to train themselves for those needs and so on. And now there's all those needs are coming down. You will have to self-adjust and make sure what is the right demand that's going to happen in the future. And if the demand is going to come in healthcare, maybe some students will choose those new alternate career paths and so on. Who knows? Plumber will become the most sought after job at some point of time, HVAC and so on and so forth. But I think jokes apart, to your point, yes, the reality is talent is short, and talent has been short in every industry that we belong to. As a matter of fact, I come from Autodesk where, while we were a software company, we were dealing with construction, we were dealing with manufacturing, we were dealing with media. And the reality was the construction workers were hard to find. A lot of the research and the state of the survey reports that we had done, a lot of our customers were telling us it's the talent actually is their biggest problem, right? Talent is the biggest challenge that they want us to solve, not the. And we were trying to solve that challenge through software. So I think same is exactly what you're saying is happening in healthcare too. There are not enough good talent available. There is talent available, but there's not enough good talent available. So the question is, and how do you bring the talent and the technology and complement them to make sure that you still can make a great combination, which probably is a new talent. And I think in my mind, that's probably the talent of the future. You will get the base talent from the human IQ and EQ that comes together. You supplement that with the AI and the technology, and then you get the larger or the complement better talent that is required in the healthcare. So I think same is the status for our industry, our company per se. Take, for example, right? I mean, in the pharmacy industry, you need a lot of pharmacists, right? You need a lot of pharmacists, right from the verification of the drugs to verification of the orders to taking calls when patients call about their prescription and so on. And pharmacist is a very unique and niche talent, right? There are not enough pharmacists in the market today, right? So what can you do now thinking about a pharmacist and supply that pharmacist with a lot of technology that they actually can use? So when I came in, and it's only been 8 to 10 weeks that I've been here, I realized a lot of the pharmacist bandwidth actually is getting spent on the mundane administrative tasks that they're doing, right? So now if I compare the talent, he or she is a pharmacist, and we're asking them to like scan a label, do a rework, enter the things again, or do the corrections, send it back to the data entry department and so on. So the reality was the productivity was low, and that's the problem, right? If I can bring the productivity of every pharmacist up by 50%, now you talked about the healthcare shortages, that whole thing shrinks by 50%. We can reduce the demand by 50% just by training our pharmacists right and amplifying their skills by technology or supplementing them with technology. You can easily do that. So we just started a couple of projects just in the last 8 weeks, and we have been able to bring our productivity up by 10 to 20% already, right? Yeah. And a lot of that was very small stuff, which was like those mundane things. Why can't the trigger come from the software rather than coming from a manual check? Why can't things be scanned from the inventory right at the warehouse to right where the ordering system is? If these two systems can talk, the pharmacist doesn't have to worry about that. So I think for me, it's that unique skill that I bring in, that being in the technology space, I'm so used to finding challenges on the technology side and the software side. And when I come in, I notice how that knowledge can come in handy. So yeah, I think exactly as you were saying, we have a responsibility to make sure that we can improve productivity by using the right technology, supplementing the right talent, and bringing the overall productivity up. And as I said, we already are seeing some benefits, but I'm sure if you and I will speak in the next 6 months, I would have gained a lot more efficiency. And we're looking at everything from pre-verification to post-verification to all the life cycle of the order management, how much more we can do. So I think that to me is a great way by which we can help the talent which is existing in the market. And then there's an altogether different field on how you can now bring up the new talent and so on. And that's a separate field that we can talk about.
Yeah, if you remember, which you will, nurses used to stand and count in their thing when IV drops.
True.
You know, how many drops goes through in a minute or something.
Yeah.
All of that was changed by technology, right? So nurses don't have to do that, and they can actually spend time in the empathy, in novelty, and high-level governance stuff. So that's exactly is going to happen all throughout. And people like you who are with critical thinking skills, it's one, I think technology gave you that critical thinking skills, and that you're taking into another industry and applying that. So, these mundane tasks can be automated so people can focus on empathy, novelty, and the high-level governance that was that human needs to do for them to be in command over whatever automation it is. It can be AI, it can be the IV drops that we talked about, any of that, right? So absolutely. Talking about that critical thinking, you probably are going to be seeing, and especially in healthcare, in your field, where 60% of the people are retiring, right? So, people who are coming in are generalists. We are not able to fill in the roles, and it is impossible. And to your point earlier, it's impossible to find good people. So what do you write a lot of Tuesday tips? I don't want that here because that will make this question very easy. But if I am one of those people who are not qualified today and who got rejected from one of those roles, what can I do to improve my critical thinking skills so the next time I do an interview, I get picked?
Yeah, and I think that's actually a good question. And I think that has remained valid for all these years. It's even more prominent right now when the talent shortages are so high. But the reality is that many times we are only focusing on the technical skills that we bring in. And I think those were important, and they will remain important. But the reality is, with all the large amount of information that we all have available, you should also know how to use the ecosystem a lot better compared to what we have done in the past. Now, I think if you think about whether it is pharmacist, technician, customer service person in my industry, or for that matter in the software industry, a lot of the talent that comes in earlier used to be given 12 weeks of training to give them all the SOP, all the stuff that happens and so on. We have been able to shrink all of that 12 weeks to 4 weeks, 2 weeks, and so on. Yeah. And the reason for that is because now there is so much information available that I can supply my starting talent with a lot of information at their fingertips through bots and so on, which could be internal facing and so on.
Time and training, or training.
Time and training. So I think same thing is true for a lot of the talent coming from outside, that you may not have the practical exposure, but if you spend the right time on internet and use the right AI tools, there is so much that you can parse through. There is so much that you can learn. Like, I did not know about healthcare space, a lot just before coming. But within 10 weeks, I've been using ChatGPT, Claude, Gemini, and so on. And you can't believe the amount of knowledge I have gained in just these last 10 weeks. It's probably more than four years of degrees that we all used to do, because the information was so sparsely available and so on. So I think my recommendation to those individuals is that they can actually get onto a lot of these tools and do a lot more research, think a lot more about what prompts they can ask, because there is information available. It's the question is, how are you asking that information and so on. And believe it or not, forget the talent that has not come in, but even the talent that actually comes in, I noticed that there is lack of urgency and lack of initiative with these individuals who think of AI usage, but only for casual purposes. They're not using it for the formal purposes like training, like coding, right? Think about a coder, right? People are able to use a lot of Claude code and build vibe coding and so on, and build applications which is not even possible just a year ago or so. Same way, I think if somebody is coming in the healthcare space and so on and so forth, if they could just spend 2 weeks of critical time, very focused time on the AI, asking the right questions, researching the right topics, going deeper into certain facets of those topics and so on, and then come back, I'm sure they'll be a lot more prepared for those interviews and those opportunities, because the specialization, there's so much information available on the market, and now it is becoming so much more accessible. So I think it is all up to us, our own intent. So yes, use that for fun stuff, but use it for real stuff also, where you can train yourself, you can challenge yourself, where you can learn yourself, you can do real-time projects with those tools at your fingertips and so on and so forth. But I think all of that is possible. I couldn't say this 5 years ago. You will have to come, make your hands dirty. And I will always say on-the-job training is the best form of training, which probably it is still is. But I think enough virtual paths have been created where you can actually make your hands dirty without literally putting your things in a mud or a stormy
So
sand.
we are really hiring for the attitude, right?
Yeah.
Because the
And
aptitude can be gained as you are working, and
absolutely.
utilizing these AI tools to just say, hey, I am learning about this, and help me, question me, or make me a better person or skilled with this, whatever the topic is, making apple pie. It's a very clever way to utilize. So definitely. So, when it comes to change management, do you see healthcare to be slow when compared to tech in terms of change management? Or are you seeing at this point there's so much investment that's happening in healthcare?
Yeah.
So I'm doubting that, but I would love to hear your perspective on where you're seeing differences.
Yeah, I think in general, the regulated industries tend to move slower, right? I mean,
Right.
healthcare, financials, and so on and so forth, because of the inherent risks which are, present to those industries. And we are no different, being HIPAA compliant, privacy, PHI, PII, all of that is critical, right? So in general, there is a lack of pace or slowness in terms of the adaptation and change management in general. But having said that, I also will say it also depends upon the area of change that you're talking about. Because
Mhm.
many times I notice the companies or organizations who tend to be slow also want to shield behind the reason or a excuse that they're not moving fast enough because of these regulations and so on. Not saying that you have to break those regulations, but the reality is there are a lot of internal things that you can change without touching the PII, without touching the HIPAA, without touching the PHI. So why there is a lack of change on the, let's say, infrastructure upgradation that you have to do. There's no reason for you to not upgrade infrastructure and so on. So I think that's where the leadership becomes very critical. We as leaders have to make sure, doesn't matter which industry we belong to, have to make sure that we are able to paint the larger picture, paint that better vision that we are trying to create for our individuals and our employees, on where we are taking them, what problems they're facing today, and how we'll make those problems disappear. As long as you can make sure that people who are going to go through the change, you can get ahead of the resistance curve, I think change is possible. But it depends upon the leader to comprehend that resistance and understand what are those underlying reasons of those resistance and how you can make sure you have a better world that you can take them to. So I think ultimately it is up to the leader to pick the right sponsors of change. You again do the usual change management techniques. Pick people who are going to be your supporters or change agents, and pick people who are going to be dragging those change and really attack or confront them with what those resistances are and how we can help them overcome that resistance. So I think the principles will remain the same, but I urge a lot more leaders to listen closely to their employees as to what the resistance really is. Many times, I think leaders are trying to make change just because they think change is great. But just
Yeah,
because they think doesn't mean change is great, right? You have to make sure change is great from an employee's perspective too.
it resonates quite well. Essentially, what we are saying is a leader's role is changing from being a taskmaster to
Yeah,
being role model, right? So, and because they have to model that critical thinking and
true.
that alertness, because a lot of times, when you use some of these AI tools, they are fed with what it's fed with. So you have to still be alert and you put it on your critical thinking app and be the skeptic and start
Yeah,
questioning it. Which one is right? Which one is not right? And a lot of that role model comes from the leaders themselves. And shameless plug to the Beyond Break Fix book. Yeah, we have a chapter dedicated to it, right? And you're
yeah,
right. Whether it is PII or whether it is HIPAA, whether it is any of that stuff, all
true.
of that can be augmented today with AI agents,
Yeah,
and all of it anything can be augmented. So there is no excuse to not bring down that onboarding time, like you said,
yeah,
uh,
yeah,
down to 40% of what it used to be or 20% of what it used to be. It's a little scary that every talent who comes in today, for example, in our company, we have 4 times AI agents. Even if you hire a manager, they are a manager of AI agents
true.
right off
Yeah,
the bat, right?
true.
So you are managing a hybrid workforce. You're managing your carbon employees and you're managing your silicon employees. So in that realm, how do you think companies, traditional companies, have to look at this level of automation so for them to be relevant 10 years down the road?
Yeah. No, I think again, in my mind, because the companies don't change, it's the leaders who will change the company, right? So I think the fundamental of this actually again starts with the leaders. I noticed that a lot of leaders
Good
today
point.
come and talk about, hey, we all need to be AI native, we all need to be AI aware, we all need to be, very deep into AI and so on and so forth.
But what does
The
it
moment
mean?
you dig deeper, a lot of the leaders themselves are not dabbling their hands with the AI and so on, right? So it's the same thing that you were talking about before. If you don't role model the AI usage in your own company by you being the AI user first, then you can't expect your managers, your supervisors, your directors to be AI aware either, right? And that actually happened to me in the last 10 weeks. I've been using a lot of chat GPT and other tools in my own life. And the moment I started sending presentations built by AI, my team actually started feeling uncomfortable that, hey, if you could make this presentation, why couldn't I make this presentation? And they started going deeper and asking for that because I sent presentation on a topic I don't even know, but it felt like I knew a lot about it because I could gain a lot of that knowledge from chat GPT and other tools and so on and so forth. So I think for me, it's very critical for all of us to really start thinking AI native. I think we have to start thinking it's the human plus machine which have to coexist going forward, whether it's the managing that you're talking about, whether it is as a peer, like you could be developing, AI could be testing, or vice versa, or you could be using human for the empathy and the softer skills to communicate those messages, but a lot of the work that you're carrying to your client could actually have been done by AI. You are the presenter, you are the empathizer, you are the connector, but you're not the doer of that work. In the
That's
past,
right.
all of those roles were so separate that you could do all the way from writing those things to presenting those things and so on and so forth. So I think we all have to get comfortable with that. And the reality is productivity will go up dramatically, right? I mean, think about the support world. I was reading an article just last week where it said that 60% of the support jobs are down compared to just last 1 year, right?
Yep.
Not saying that the overall support roles are down. Support roles are still up because overall companies are there and so on. But the same company is able to do a lot more with 40% of the agents that they had in the past and so on and so forth. So the reality is that the workforce will shift. So are you investing in those future forward insulating areas or not? So I think as leaders we have to start identifying what is possible to be done with AI, where it has to be human plus AI and where it has to be human only. Because there are certain cases, like in my own case, when a patient calls and they have questions about a medication, they do not want to talk to AI because that's where they have a concern. They want to really make sure that this particular thing will not infect me or give me another thing and so on. At that time, telling them, try one, press two, it's very uncomfortable. So I think we have to make choices for which roles are right for a human interaction versus where we can do the stuff. As I was saying, the prescription can be scanned and processed through the whole process, and that can be fully automated. The patient doesn't care because that area is not impacting them personally speaking. But when somebody's talking to them and talking about the after effects of that medication, then you need the human and so on. So I think as leaders, we'll have to become a lot more smarter about bifurcating our departments into every single department, by the way, marketing, sales, consulting. I mean, every single department has to think what all is possible from an AI perspective, what all is not possible, and what all can be trained. And then we will have to make sure that we are all becoming a lot more AI native in terms of our own trainings, in terms of our own usage and so on. And then also, I think we have a responsibility as leaders not to just take care of the employees that we have in our company, but also the future talent that is coming in, so that we can show them the light, what are going to be those newer areas. Because just like when the internet revolution happened, newer roles got created. I'm sure there'll be a lot more newer roles that will get created in the AI. So I'm not here to make a prediction whether AI will take away jobs or not, but the reality is that there will be new jobs that will get created, and we have to be ready for that. So I think we all will have to make sure that we are contributing from our perspectives where we are to move the company forward, to move our employees forward, and to move the future talent forward also.
Yeah, thank you so much for that. You and I can talk for another hour on this topic, but we try to keep the experience dialogue 20 to 30 minutes, so
Sure.
it's sizable chunks. So I'm going to pause the recording for now, because I think at this point, the biggest lesson that people can take away from at least this episode is to be a role model and give it a try. Try to be a role model. Try to the bite sizes of how to use AI into the system and how to use automation into the system so we can alleviate some of these concerns in healthcare. Thank you so much, Jaspreet, for your time. Thank you so much for being here.
Thank you so much for having me. It was wonderful. Thanks a lot.